My name is Anamika Singh, and I will be presenting the stress reduction interventions for families post NICU discharge. While there are some research studies focusing on the stressors involved before the birth of a preterm infant and during the NICU stay after the birth of a preterm infant, there are a few studies focusing on the stressors involved after discharge. The purpose of this literary review is to comprehensively determine interventions that may reduce stress in families with preterm infants post NICU discharge. Through the use of different databases such as PubMed and PsycInfo, 17 articles were reviewed based on the following common keywords listed. Looking at the results section, across all 17 studies that were reviewed, stress was assessed using a variety of questionnaires. With examining the post-discharge interventions and outcomes table, there are three main stressors identified throughout this study review. The first stressor identified is the complexity of community-based resources. Telemedicine was preferred for families since it diminished the need of hospital visits and provided more flexibility. Families were reached by text messages and phone calls aside from video calling. Additionally, social media and networking help families engage with other families going through the same journey. The next stressor identified is the lack of emotional support. Parents received emotional and social support from their family, friends, and NICU staff after NICU discharge. Some home visits by nurses were done within the first few months to see the progress of the family and address concerns in person. The last stressor identified is the lack of readiness. The Mother Infant Transaction Program is an early intervention that aims to enhance the parent infant relationship and child development that starts before the family leaves the NICU and progresses months after. In one study, the intervention parents reports that the advice, guidance, knowledge, and emotional support given through the intervention made them feel less stressed and more confident, competent, and secure. Following the results, we have also identified limitations for this study review. First off, there were limiting research focusing on stressors and interventions after NICU discharge. For instance, some researchers may have modified the MITP sessions and content of the original protocol, making it difficult to compare the results and determining the effectiveness of the intervention. With modifications to the program, the effectiveness of the program could have had altered results. Moreover, selection bias evidence was uncovered. First, infants were excluded from the study if they did not complete follow-up within a 2-year period. Second, data of only those parents who were willing to take the time to complete the questionnaires were obtained. The findings from this review can be implemented in research and practice. Parents who participated in selected studies such as the MITP stated that the intervention should be extended to other professionals. It is important to educate other healthcare professionals about the role of social support and coping mechanisms in modifying stress. This can help healthcare professionals design appropriate discharge programs for families of premature infants, helping the parent feel more at ease upon discharge. More research is needed to identify the specific stressors on parents and the preterm infants post NICU discharge. It would also be beneficial to study the effectiveness of post NICU interventions in diverse groups of varying socioeconomic statuses and cultures. Overall, it is crucial to identify potential stressors beyond the NICU environment, including stressful family environments and stress experienced within couples. Through the interventions listed in the results section, parents can have less stress in caring for their preterm infants that will be beneficial to the family in the long run.